Hi, I'm Dr. Maloney from Rebound Sport and Spine, and today I want to talk about cervicogenic headache and chiropractic treatment. So I have a fair bit of success with treating cervicogenic headaches. What cervicogenic headaches, or the cause of cervicogenic headaches, are one of them is tightness in suboccipital muscles. So suboccipital muscles are the little muscles at the base of skull. They can get very tight and they can cause a referred pain that sort of wraps around the top of head and sometimes feel like you're wearing a hat that's too tight, or even like a sweatband that causes sort of tension in sort of the forehead or the frontal lobe. Other causes of cervicogenic headache are facet compression, and again, you can get referred pain. The facets can actually feed back pain signals to the brain that causes your brain to get kind of fuzzy and feel sort of confused, and that's part of what can cause cervicogenic headache. So typically what I like to do is a quick assessment to see if I notice anything with cervical facets and to see how the neck is moving. If the facets are restricted or there's tension in the suboccipital muscles, that's stuff that we can assess. So when I do a quick assessment, or when I do an assessment of the cervical spine, we're going to do an assessment on Raf here. So Raf, I'm going to get look straight down to the ground for me. Good, how's that feel?
A little tight.
Okay, a little tight, straight up to the roof. Okay, good range. Any pain there?
No.
Good. Look over this shoulder for me. And look over this shoulder for me. Is one side easier than the other?
Probably maybe this way.
Okay. Do you feel any restriction there at all?
A little bit.
Okay. Go ear to shoulder here, bend head sideways. And go ear to shoulder here, bend head sideways. So we do notice a little bit of restriction with lateral flexion. We do notice a little bit of restriction, and so does Raf, with rotation. Okay. We'll continue on with a little bit of assessment. We'll get you on your back here. So face up and hat off if you don't mind. So I'll check the facets manually. So we checked actively with him moving his own neck, and I'll check manually. And typically what we notice, or what the patient will notice, is there's some points that I touch that are a little tender. How does that feel there, Rob?
A little tight, yeah.
Okay, a little tight. How about that there?
Yeah.
Okay. So a little worse on the right side is what we noticed. It's sort of consistent with some of our findings with the active part of the testing. And what I like to do is palpate in suboccipital muscles. If I can recreate headache, again, it could be one of the issues that causes the cervicogenic headaches. How does that feel there?
Kind of tight.
Okay. Does that recreate any headaches for you at all?
Kind of towards my eyes.
Okay. So a lot of people can feel this in the back of the eyes. One of the little tests I use when I show patients is I can get them to close their eyes, and I can get them to roll their eyes around the back of their head, and you can feel these little cervicogenic muscles, these little suboccipital muscles flicker, right? There's no neck movement, so you can tell that they're intimately connected to eyes. So people that sometimes get the headaches in behind the eyes, it comes from the suboccipital muscles. So we can do some soft tissue to loosen it up, but just to speed things up a little bit. Now, Raf, are you okay if we do some adjustments for cervical spine here?
Sure.
Okay, so typically chiropractic adjustments are targeted towards the facet joints that are restricted. Usually you get popping and clicking, and the popping and clicking is just the facet joints that are stuck together. When you pull them apart, they make the same noise that suction cups do. Okay, so we'll do a quick treatment on Raf here. Good, good. So now, how do you notice any pain here?
Not anymore,
Okay,
no.
so a little bit better. So I noticed manually just pushing over some of these joints that they are moving better. It's not the best way to test, but it gives us some indication. We'll do this side too here. Good. So we got a fair bit of popping, clicking, crackling out of it. And again, that's just the facet joints that we have now just unstuck. What we'll find is when we sit Raf up, when he moves his head into rotation, flexion, and lateral flexion, it should move a little bit better. And typically, the cervicogenic headaches, you get fairly instantaneous relief. So come on up. So try looking straight down to the ground now. Good. Straight up. Good. Look over here. Good. And over here. How does that feel?
A lot looser.
Yeah, so a lot looser. And again, when your head isn't screwed on so tight, most people feel like there's a little bit less pain and restriction. So I'm Dr. Mark. I'm for Rebound Sport and Spine, and that's a little bit about cervicogenic headache.